You're listening to The Good Morning Show with Oliver O.T. Thomas.
We're back. Welcome back to the Good Morning Show. Haley?
Yeah.
Haley Leday, right? That's why I can't wait to have reality radio. So like all those off-air conversations, right? We'll be on VH1, right? Production, little black radio station. What happens off-air, they'll be paying us a whole lot of money. But first of all, welcome back to the Good Morning Show. We want to thank all of our guests, guys. But look, let's not forget, man, about the Carver Theater Wonderland Christmas Festival that's happening this weekend. The Black Film Festival of New Orleans also happening. There's so many things going on, man. The jingle on the boulevard in New Orleans East. We want to thank Governor John Bell Edwards, man, for coming back and spending some time with us here again on the Good Morning Show, and his quest and his effort to make Louisiana all that it can be, and the state that it needs to be for the folk who live here. I want to thank Bishop Brian Warner and Councilmember Cindy Wynn for the second annual jingle on the boulevard, and also Mr. Misty Fry, Mr. Charles McCall for the Wonderland Festival at the historic Carver Theater, and of course Gian Smith, our last guest, the Black Film Festival here in New Orleans. And in the studio with us now, we told y'all they were coming. They're here, Miss Haley, Miss Haley Ledette, who's a member of the New Orleans Maternal and Child Health Coalition, and Dr. Claire Daniel, also a member of the New Orleans Maternal and Child Health Coalition. Guys, welcome to the Good Morning Show.
Thank you. Thank you for having us.
Well, we like people who like to be had, especially right here on the Good Morning Show. Haley, if we can start with you.
What? Why?
Right? We can start with you. Okay. The New Orleans Maternal and Child Health Coalition is its mission and why it's so important to what we do here in New Orleans.
Yeah, okay, but I'm also going to say, Claire, please help me out with this.
Absolutely.
Will do. Yeah, so the New Orleans Maternal and Child Health Coalition, we started, I guess, officially last year. And we're basically just this group of stakeholders in maternal child health. So we have people from lots of different community organizations, like Birthmark Doula Collective, System Midwife Productions, Nurse Nikki, Saul's Light, who I believe you had on recently.
Absolutely.
Thank you to Kimberly, by the way, for inviting us to this show, or for connecting us with you.
Mm-hmm.
And we are also made up of some researchers from Tulane University studying maternal epidemiology and racial issues. And our mission, really, we don't have an official mission statement. We're working on that right now. But I would say our mission is to make New Orleans a safer place for families to grow, and to reduce health disparities in maternal and child health. Because we're going to go into this a little bit, but there's a lot of racial disparities between maternal outcomes.
Absolutely, from early childhood birth to the birth defects to birth weight. And Dr. Daniels, these are historical issues that have affected New Orleans for quite some time, especially if you look at strips of New Orleans that come down to Mississippi through what we call Chemical or Cancer Alley. Talk about the importance of this work and why this coalition is important, not just for highlighting, in many cases, what we already know, but to begin to eliminate these chronic illnesses and end these health disparities.
Mm-hmm. Yeah, I think that one of the really, great things about the coalition is that we're bringing together a lot of different types of people, as Haley mentioned, and so in that way we're kind of hopefully breaking down a lot of the silos that exist. There's already a lot of really great work going on, and there has been, for a long time in the city around maternal mortality, severe maternal complications or pregnancy-related complications, infant mortality. But hopefully what we're bringing to the table is we're helping to connect all of the voices together into the same conversation.
And guys, I want both of you guys to share. You talked about epidemiology and racial issues. We know now, dealing with this issue, especially around childbirth, Gabrielle Union, many leading actresses and leading ladies of color talked about the disparity in death during childbirth and the adverse effects, the maternity adverse effects it has on women of color.
Yeah, so are you referring to like Beyonce, Serena
Absolutely.
Williams? Yeah.
Absolutely.
Yes. So it's an interesting thing. So like usually in terms of like health issues, as people sort of reach those levels of success, like socioeconomic status, higher education, higher wealth status, their risk of issues like health issues decreases. But we see that for maternal morbidity, mortality, and for infant mortality, actually black women who are professionally educated, like with med degrees.
Who have money.
Yes, exactly.
Access to top health care.
Right. They have the worst outcomes. They are more likely to die of pregnancy-related causes. Their infants are more likely to die than white women who are at the lowest socioeconomic levels.
There's a term you guys have here that says severe maternal morbidity. What does that mean, and what is that term, and why is it so much more complicated here?
So severe maternal morbidity refers to things like complications that can occur, like when someone's giving birth or immediately after, or like during the whole of the pregnancy. So that can be things like hemorrhage is a big one, so like excessive bleeding right after birth, cardiovascular issues that require some kind of intervention, embolisms, things like that. It's a little complicated because everyone kind of has their own definition of what counts as a severe maternal morbidity, but the CDC's, according to the CDC's definition, for every woman or person giving birth who experiences a mortality, who dies, there's up to 100 people who experience a complication and come close to dying. And so that just kind of gives you a picture of why it's important to think about complications.
Dr. Daniel, a lot of this stuff we're very familiar with. I remember going back to the when I came back to New Orleans in the late 80s and early 90s, under previous administrations that looked about health disparities, especially with infant mortality, low birth weight, and those issues. But still today, we're still talking about the same thing and the same issues. What have we missed? What have we not resourced? And what do we have to begin to do, not just to begin to talk about something that we know about the last several decades, but to make sure we're eradicating it?
Well, I think one of the things that is so frustrating about this issue is that it's not only not been getting better, but by many measures it's been getting worse. And so I don't know that there's a magic bullet that we're able to point to, but for instance, the Maternal and Child Health Coalition just did a presentation in front of City Council last month where we asked for the city to consider 3 interventions that we think will,
3 interventions
okay, that we think will help, and that there is evidence to suggest will help.
And I'm going back to the work of Great Expectations several years ago, if you know the history of some of that work here. So not to cut you off, but back to those 3.
Yeah, so universal postpartum home visits, because, and Haley, you can get the statistics probably better than I can, but there's a good portion of these deaths that occur after childbirth. And so having home visits helps to catch things that will help us to prevent those deaths. I don't know if you want to chime in, Haley.
So the biggest chunk, like as Claire mentioned, of maternal
and what do you call that? You call it postpartum?
Postpartum,
yes.
Yeah. So postpartum means after birth, and that can be, I mean, people have their own definitions, but really after you give birth for the rest of your life, you're postpartum.
After you have after you have the baby.
Yes.
Okay, right.
But the official definition, so before it was up to 6 weeks. Now this next cycle of Louisiana looking at maternal deaths is going to be up to a year after people give birth. But for the most recent maternal mortality review, so for every for all the deaths that are happening, pregnancy-related deaths, there's an actual committee that's looking at all these deaths, and that's deciding what are the contributing factors to those deaths, why did they happen, and could we have prevented them, how could we have prevented them. And so for the last cycle, when they were looking at, I think on that paper it says from like 2011 to 2016, for all the deaths that occurred, 45% of those were preventable, and the biggest chunk of them happened, like Claire said, in the postpartum period, and I believe it was 45% of those.
Another thing that I like as part of what the coalition is doing, Dr. Daniels and Haley, is that the diversity in who provides the service. You know, we talk about cultural competence. We've talked about that with many of our leading professionals in the medical industry, whether it's mental health or applied medical help. But talk about this diverse health workers. Why are they important in this issue?
Well, I'll start and then you can.
Right, absolutely.
Yeah, so the second thing that we asked the City Council to consider is a program or multiple programs that would help to break down some of the barriers that exist to Black and LGBTQIA people becoming community health care workers. And so there are a lot...
Making an intentional investment in those populations.
Exactly, yeah. The costs of training can be prohibitive to people, and we know that it's really important for Black and LGBTQIA clients or patients to have advocates and to have healthcare workers who resemble them and who understand who are culturally competent. And right now, our workforce is not diverse enough. It's not diverse in ways that reflect the New Orleans population.
Right. Exactly. I think you really hit the nail on the head.
The teamwork works, right?
Yes, it does. Yeah. So we were specifically asking for funding to train these people or to fund scholarships for them to get their own training, and specifically doulas who are. I don't know if you know what a doula is.
Well, I was in Nicole Diggins' play a couple of years ago about doulas.
That is my mentor.
Yeah, about doulas. I was actually one of the leading men.
Oh wow!
In that show that she did on doulas, and I learned so much, man. And since then, I've had a real education. I've met several doulas who play a critical role, and I've always wondered why don't we know more about doulas, and why aren't they part of our standard medical industry and providers in this area?
Yeah. So actually,
you see, I know a little bit.
Oh, I'm good. I'm glad.
So talk to everybody else who doesn't know doulas, their role.
Yes. So I'm glad you mentioned Nicole. Nicole is actually part of the coalition, and she trained me to be a doula. So doulas are pregnancy, birth, and postpartum companions. A reminder, postpartum means after you have the baby. And they provide emotional, informational, physical support to people as they are going through their journeys of pregnancy and birth and the postpartum period. And I mean, honestly, I think doulas, you asked this question of why aren't they part of the medical system, and I think it's because they are there to sort of fill in the gaps of the medical system. Like, if the medical system was equitable and if it treated everybody the way that it was supposed to treat everybody, we wouldn't need doulas.
And we wouldn't have these disparities.
Right, exactly. And so, yes, that's why I think doulas are important, because they provide sort of that culturally competent, respectful care, and really hands-on engagement with people that I think that a lot of times medical providers maybe just don't have the capacity or the training or the education to provide.
Haley Leday, we're going to stay with you for a minute here, because I think it's important. First of all, God bless you for the work that you guys are doing, you and Dr. Daniel. I think it's important work, because if we can't give our children and our infants the best when they start, right? And if we can't give our mothers, our nurturers, those who are there, especially in the beginning of our life cycle, then it's no wonder that Louisiana is 48th or 49th in the well-being of children.
I absolutely agree.
It's no wonder that we have one of the smallest per capita events in early child education and in infant mortality. Talk about why you chose this work. On the front end, because if we do the work and investment on the front end, then we don't have to worry about the middle and the back end.
Yeah. So I actually got into this work for those exact reasons. I was a student. I'm still a student, but now I'm a graduate student. But when I was an undergraduate student at Tulane...
She's a big girl now, guys.
When I was an undergraduate student at Tulane, I took this class, and we watched this documentary about birth disparities, and it was saying how things like racism and sexism influence black women's birth outcomes and cause them to have higher rates of preterm birth than white women. And that really kind of just shifted the way that I thought about health in general, because it made me realize that I thought I wanted to work with kids, black kids, but then I realized that kind of childhood was already too late to intervene with a lot of these things, because black kids were at a disadvantage from before they were even born, because their mothers were at a disadvantage. And so I was like, well, maybe I should get into birth work. And I did. And now I really do see doula work and birth work as a public health tool. I really do think that it is an investment. If the city invests in birth workers, they are investing in the long-term health of black women and children, really all women and children in all families, people of all genders in the city.
Dr. Claire Daniel, I think you also uniquely qualified, given your background, not just as a assistant professor at Newcomb, but with the scholarship that focuses on reproductive politics and public policy. We had the governor on with us earlier, his fight to expand Medicaid and Medicare, fighting against the conservative legislature. But specifically that public policy and what our leaders do also impact this area. How important is it, not just the work that Haley and others have committed to as a career, but also on the public policy side?
Right. Excuse me. It's so important, and that's part of what the purpose of the coalition is to help bridge the research that's being done on this, right? The data that we have that shows these disparities, the really important community-based work that's being done by doulas and other community health workers and organizations, to policymakers, right? To inform policy, right. Because as we mentioned earlier, there already is a lot of work being done on this, and there's work being done at the state level, there's work being done at the city level in government, right? But part of what we're hoping is that the coalition, being made up of such a diverse group of people, and people who are really well connected to the populations that we're talking about, that whose health outcomes we're trying to improve, that we can make better policy and have that community voice really inform that policy.
Guys, for our listening audience out there, we highlight a lot of topics and a lot of people have influence in a lot of areas. But we've also dedicated to the show what happens to our children. We talk extensively about Louisiana, its position with our kids, and I think the work that Haley and Dr. Claire are doing is important work on the front end that can ultimately help change the direction of our children, whether it's infant mortality and birth weight, to the per capita investment that happens in our kids. Guys, how can people get in touch with you guys, support this coalition, and be part of this movement to make sure that we're getting it right on the front end so that we don't have to fix it on the back end of the lives of our kids?
That's a great question. We're still sort of working on our communication strategy, and hopefully at some point we'll have a website. But as of now, we do not have a website, but we have a pretty open door policy in terms of just anyone who cares about these issues and wants to be involved in the conversation can connect with us. The best way to do that is probably to email me, and my email address is cdaniel, so CDANIEL, and then the number 5 at tulane.edu.
And Ms. Leday, for speaking engagements, to talk to groups, have you continue to do your critical research in this program, how can people reach out to you?
They can also email me at hledet@tulane.edu. But I also want to say that if you want to support the coalition, really, because what we're trying to do ultimately is to amplify community voices, we want to hear from you. We want to hear your stories. You mentioned Nicole Deggins earlier for Sister Midwife Productions.
Nicole Deggins, Molly Thomas, several people I've met who do this work.
Yes. So I actually work with her to create what we call the Birth Story Project survey, and that is a survey for anyone who has ever had a baby in Louisiana, of all races, not just Black people. And ultimately what we want to do with that is to gather people's experiences, because policymakers really like numbers, but we really want to reaffirm that these are people's stories, and we want to gather all those stories so that we can then bring these stories to them and tell them, these are the things that need to be done to fix the system, to make birth safer for people in Louisiana. And so if you want to take that survey, because we really want you to take that survey, you can text Birth Story, BIRTHSTORY, to 484848, or you can also visit thebirthstoryproject.org and take the survey, because we want to hear your voice.
You guys promise to come back as we track these numbers and track this particular effort here in Louisiana? Y'all going to come back in the future?
Yes, absolutely.
Yes, of course.
Thank you so much for having us.
And I'm going to recommend one of our contributors here from Think504.com, Jeff Thomas. When you talk about the website, Jeff would be great. He's one of the best, I think, at developing websites and looking at content. He's also the owner of Black Source Media with over 300,000 followers, with the newsletter and the blog that he does. It'd probably be a good way to communicate, to get the message out. So I'll make sure you guys can connect with Jeff on this particular issue. And guys, look, it's been a wonderful show from the governor to Ms. Leday and Dr. Daniel and the work that they're doing. But the governor can talk about his vision, but it's up to us to develop and enact our own vision before it gets to the governor. The young women here, Ms. Leday and Dr. Daniel, can talk about what we can do for our kids. But before we get to what they can do for our kids, we need to also think about what we're doing for our kids. It starts in our house and in our homes first. And one thing we know, if we take care of our children and we invest in them and we nurture them and we water and we help them grow, we don't have to worry about the back end, because the front end assures us that the back end has the best chance possible. Y'all have a wonderful day. And if there are any hurdles and obstacles in your way, if you look in the mirror, if you're the only one you see, don't wait for somebody to move them. Start knocking them out the way yourself. Have a good day.